Cause, let's go.
Philosophy and theology with sociology and biology? Are we talking about mythology, or is this new public policy?
Check it. Philosophy, theology, sociology, and biology. Are we talking about mythology, or is this new public policy?
You don't have to be a prodigy or a specialist in oncology to know that bioethics is part of an apology.
Come on.
But creating painless vaccines and finding a cure for AIDS can only happen with your help.
Come on.
Research participants play a critical role in the advancement of medical breakthroughs.
Research in stem cell could lead to a Nobel, from nanotechnology to new pharmacology.
So, welcome to our Black History Month special, Advancing Equitable Distribution of COVID-19 Vaccines in Communities of Color, shedding light on the long shadow of the Tuskegee syphilis study. My name is Dr. Stephen Thomas. I'll be your guest tonight. And we're just so happy that you have taken time to spend with us. And you're going to meet my other compatriots, including Gloria Aparicio Blackwell and our moderator for tonight, Mayor Omar Neal. And our guest speaker will be Dr. Michael Osterholm. Now, I'm now in the Hollywood Squares, and I want you to say hello. Gloria, here we are again.
Amigo, we are here again. This is our place, and I'm so excited to be around all these wonderful people, and hopefully we'll have a great conversation. I know we're going to have a great conversations and get everybody into the line of getting the vaccine. And then we can all hug each other and see each other again in person.
Okay, so you really do miss me, huh?
I miss you. I miss a lot of the friends here. I miss also, I'm glad that Mayor O'Neill is here as always. I'm very impressed with him, with his action and energy, and I wanted to see him in person.
Absolutely.
Hey, Omar, welcome back, Omar.
Hey, man, and good to see you and all of the wonderful people who are joining with us. And Gloria, you didn't start off with any Spanish. And you just make me feel so warm when I hear you say something in Spanish. Would you please just say something to me in
Buenas
Spanish?
noches, mi amigo. ¿Cómo estás?
Okay,
See,
same to you. Same to you.
You feel better now?
Yeah, I feel better now.
We're also so happy to have my boss, my dean, Dr. Boris Lushniak. Hi, Boris.
Hey, how you doing, Stephen? And just as a quick welcome to everybody, our special guest, Dr. Michael Osterholm. You may not remember me, but I was EIS class of 1988. And at some point, you actually asked me a question during my EIS presentation that made me look about this tall.
Oh, no.
Oh, yes. I still remember that. But that was a long time ago. And it's great having you here at the School of Public Health at the University of Maryland in College Park. To all our panelists and to all our guests, right, in the midst of this important recognition of this month, at this critical time in world history, right, and to have that difficult conversation about the vaccine, about the past, what did we learn, and how do we make things better, right? And that's a key feature of all this. There's got to be a better situation ahead of us in all this. So thank you so much, Stephen, for the great work that your team has done with the Maryland Center for Health Equity. And I'm eager to listen in on the rest of this evening's happening. So welcome, everyone.
Thank you very, very much. And we also have our collaborating organization is the Maryland State Medical Society, MedChi. And we have Dr. Michelle Manahan here with us. You can turn your camera on, Dr. Manahan, and bring a welcome from MedChi Idea Task Force. You're muted, my friend. There you go.
Always. Hi, everybody out there. I'm Michelle Manahan. I'm the immediate past president of MedChi, which is the Maryland State Medical Society, representing physicians across Maryland. And I'm also part of our IDEA Task Force for Inclusion, Diversity, Equity, Empowerment, and Advocacy. And I'm just so excited that we're all here together to have a forum like this town hall so that we can learn from each other.
Well, thank you so much. And just for the audience out there, and you can keep your camera on, Dr. Manahan, tell them what the IDEA Task Force, what's the IDEA stand for?
IDEA stands I for inclusion, D for diversity, E for equity and empowerment, and A for advocacy.
So thank you very much. And we're so happy that the State Medical Society has taken that challenge on as an opportunity to make real difference. And we have one of the nation's leaders in the field of helping us understand this pandemic, Dr. Michael Osterholm. Let me just give you a little bit about him, show him some respect as we bring him to the stage. Dr. Michael Osterholm is the Regents Professor, the McKnight Presidential Endowed Chair of Public Health, and Director of the Center for Infectious Disease Research and Policy, CIDRAP. Distinguished Teaching Professor in the Division of Environmental Health Sciences, School of Public Health, and Professor in the Technological Leadership Institute. But most importantly, he's not a stranger to us. He is a friend, and he has been here before. And we are so happy to have you here, Dr. Michael Osterholm. Say hello to the audience.
Well, first of all, thank you very much for having me again. And anytime I can be with you, Dr. Stephen and Mayor Omar, I know it's going to be a special night. And so I have to tell you, thank you very much. I'm so honored to be with you, both of you.
Thank you. Thank you very much. And so you're going to be on camera with us as we move along through the process here. And one of the things that we have pioneered, and I'm going to go and share my screen here for a moment. And whenever I share my screen, please, everybody out there, cross your fingers. We have 200 plus people in the audience. And what an amazing response to the call. We're going to have two segments. You're going to see our panelists here for panel 1 and panel 2, and you'll hear more about these panel members as we move through the process. But our first exercise is what we call our word cloud. This is Gloria and myself and Omar and our dean and Dr. Manahan. And oh, don't let me forget, behind the scenes, this is the crew behind the scenes making all this work. And Omar, isn't it important to make sure we honor our students?
Absolutely. These are the people who you don't see, but we could not be successful in doing what we're doing if it were not for them. So kudos to them.
And before we begin, let's acknowledge the fact that we've hit one major milestone in this country, and that is 500,000 people have passed away from this virus. The numbers are staggering. And we'll all just go silent just for a moment of reflection. Thank you. And we have some panel members who come from the clergy. And before we leave here, Omar, we're going to need them to help us get ready for what's ahead. And I just wanted to put this up, not to put one of the panelists on the spot, but when the barbershop shows up in The Economist, Dr. Osterholm, I think we're on to something. We've gone from the margins to the mainstream here.
You have, and I think that what really this speaks to is both trust and understanding. And public health is but little if it doesn't have trust and understanding. And I think that what you have done is helped us all better understand how that is such a critical element of what we're dealing with today with COVID-19. How do we work with the community? It won't work if we don't have trust and understanding.
And big Dynamite is actually in the Hollywood Squares doing his work. You're going to meet him in a little bit. But right now we want the audience to help us with a little exercise. Our team behind the scenes, go ahead and give the instructions for what's going to happen here. You're going to see a link in the chat. We're going to ask you to click on that link and follow it to a site where you can enter a word, the word that best describes how you're feeling right now at this moment in the pandemic. You can put in as many words as you want, just one word at a time. And Chinadu, you can turn your mic on so I can hear you and make sure they have what they need.
Yes, so I've just entered the link in the chat. Like Dr. T said, go ahead and follow the link and feel free to answer the question as many times as you like.
And then when that word cloud is ready, you're going to let me know, Chinadu?
Yes.
Okay, very good. So we're going to keep that open for 30, maybe 60 seconds. So I'm going to keep talking and moving forward, but you're going to keep adding those words. So Chinadu, are we able to see that in real time?
Yep, I'll share my screen now.
Okay, I need to stop sharing so you can. There you go, buddy. You got the controls. So yes, just keep adding those words. And Gloria, you see it building there right in front of you.
Yes, we're going again. And I see the word esperanza,
You got to translate for us.
hope. Remember last week, that was the same word that came, hope, optimism. We're optimistic that we are seeing something. We're a little tired and anxious, preoccupied, drained,
Exhausted.
exhausted. Yes.
Yeah.
So while this word cloud is building, I want our first panel to turn their mics and cameras on. That would be Dr. Gregory Branch, the director of the Baltimore County Health Department. Turn your camera on, Dr. Branch. Dr. Leonard Richardson, internist and flight surgeon. Turn your cameras on. Mr. Mike Brown, Dynamike. He's got his on and he's working. Dr. Sandra Quinn, we see you. Great lights on you, Dr. Quinn. I love that you've got your Zoom working. And Dr. Tuesday Cook, MedChi from the IDEA Task Force. And so I want each of you to simply say a little bit more about yourselves as you look at this word cloud. Dr. Branch?
Well, good evening, everybody, and I'm giving a virtual fist bump to everyone at this point now, and thank you for inviting me here. I am the Director of Health and Human Services for Baltimore County in Maryland, and I'm also the Health Officer for Baltimore County. As I look at these words here, I think I'm feeling every single one of them. As many of you know, I actually had COVID-19, and so I had to battle with Rona. But I can sit here and tell you today that I won that battle, and I was blessed with that. But unfortunately, there are so many people who have not won that battle, and I've got over 1,120 people who are in my jurisdiction who have succumbed to that disease. So I spend most of my days, my waking hours, trying to work on how we're going to get that vaccine into people, and specifically my Black and Brown residents. So I'm glad to be here, and I just want to thank everyone for inviting me.
Thank you very much. Dr. Leonard Richardson, what do you see? And tell us about yourself a little bit.
Hi, can you hear me?
Yes.
Well, thank you for having me. It's truly an honor to be part of this panel. And when I look at this word cloud, I feel very, it describes a lot of what we're going through. Right now, I'm one of the physicians that on the front line taking care of physicians down at the convention center, Baltimore Convention Center Field Hospital. And I tell you, sometimes we're tired, we're worried, we're anxious, overwhelmed. We have to display extreme caution. And a lot of us are drained. A lot of my colleagues are drained. They're going through depression, anxiety, post-traumatic stress disorder as we try to battle this thing. But at the same time, we are also hopeful. And that's one word that I see coming through very often. We are excited about the possibility and the possibilities of what the future holds. We're grateful for the introduction of the vaccines. So it's a number of feelings that we're having. And I just want to encourage the other providers out there who are on the front line to just continue to look out for each other, to continue to be hopeful, and we'll get through this.
Thank you very much. Dr. Sandra Quinn, tell us about yourself and what you see.
Good evening, everyone. Thanks for having me. I am professor and chair of the Department of Family Science here at University of Maryland, senior associate director of the Center for Health Equity, co-investigator on Communivax grant and have a number of other COVID-related activities. My area works vaccine disparities and communication about vaccines in both routine and pandemics. And I think I'm with one of our previous panelists who said, in many ways, I'm all of these things. As tomorrow the FDA's advisory panel considers the Johnson & Johnson vaccine, that's hopeful. When it's approved, that's one vaccine and one shot. It doesn't require extensive cold chain storage. It will be easier once there's adequate supply to disseminate into the communities we're concerned about. And yet, there is a dark cloud, or as Dr. Osterholm says, a hurricane off the coast that we have to be paying attention to and not become complacent and think that, life will return to normal right now. But we have positive things happening. And if we can hang in there for a while longer, we will continue to feel more hopeful, and we have more sort of foundation for that hope as we get more people vaccinated.
Thank you. Dr. Tuesday Cook.
Good evening, everyone, and thank you for inviting me to be a panelist in this necessary discussion. I am Dr. Tuesday Cook. I am a fellowship-trained minimally invasive and bariatric surgeon who trained for medical school and residency in surgery at Howard University College of Medicine, Howard University Hospital. And looking at this word cloud, I actually, like my colleagues, feel just a bit of every one of these things. I am a surgeon, and I currently practice all over Maryland, especially in critical access hospitals, and have seen COVID patients on a regular basis and had to operate on them, increasing risk to exposure. And I will tell you that despite having to see COVID patients and operate on COVID patients, I still was hesitant about getting the vaccine, because though I am a physician and educated, I still am a Black person in this country, the United States of America, and had many worries with regards to the vaccine, knowing the medical apartheid and the history of the lack of equity in this country. And so being educated in science, I'm also educated in our history, and so had many fears with regards to getting this vaccine. I had to do a lot of soul searching, a lot of discussion with my colleagues, a lot of article reading of the scientific journals and research. I had to pray and, really dig deep in order to make an informed decision to get the vaccine, which I ended up doing. And personally, I had no side effects after the first or the second dose, even though we know that there can be. And I feel comfortable now being able to speak about vaccine questions because I've researched so much to be able to get it myself. I would never, ever join a panel or speak in a discussion to encourage people to do something that I couldn't do on my own. And because I had such a journey to do this, I feel like I now can give not the go ahead or the okay, but be able to help people make informed decision on their own, and offer any kind of guidance that I can to debunk myths and to decrease the disparities that are happening, even with the vaccine being distributed currently. Chicago, Michigan, New York, Maryland, you name the place, and the counties that have higher rates of Black people living there and Latinx people living there have higher death rates, but lower vaccine administration. And so I just want to make sure that I'm able to provide any information that I can based on research that I've done and reading that I've done, just being a Black person that lives in this country. So again, thank you for having me here to speak.
Thank you for being here. Mr. Mike Brown, if you can, just share what you see in there and introduce yourself, sir. And I want—
Hello, everyone. I'm Mike Brown, healthcare advocate, barber stylist, and a certified healthcare worker. When I look at this word cloud, I've experienced a little bit of all of them. Definitely tired, definitely overwhelmed from battling with the people with misinformation that the reason why they won't take the shot. And the whole thing is what I'm asking them, if the vaccine is plan A to stop the spread of this virus, what's your plan B that has scientific background on it to tell us that it's going to work to stop it?
And so Mike has a slow connection there, and that's one of the onboarding issues as we're asking people to use the internet to get access to the vaccine and to register. And so thanks a lot, Mike.
Okay.
Yeah, okay, you came back. We'll come back to you.
Okay, good.
And Chinadu, I'm going to let you stop sharing the screen, and you're going to put up the next poll. And what we would like you to do is look in that chat box once again. Chinadu, let me know when you got it. And while Chinadu is putting that together, Dr. Michael Osterholm, you heard the first panel speak to what they saw in that cloud. What did you see, sir?
Again, I come back to the earlier comment I made about honesty. People are feeling a lot of things today. This virus has not only attacked our bodies, but it's attacked our heart and souls in a way that we haven't always understood and appreciated. It's exposed so many of the fragile aspects of our society. And I believe that to actually heal ourselves from this pandemic of a virus, we also are going to have to work to heal things that we hadn't normally thought of. And I think the inequalities that this pandemic has thrust upon us, the issues of financial security, of food security. Imagine 1 out of 5 households in this country right now are insecure for food. You know, this is the great nation of the United States of America. And this pandemic has made that happen in a way that we had never fully appreciated. And so I have always believed that there is opportunity in resolving crisis. And so I think the fact that I'm here, the fact that I get to talk to Dr. Stephen, the fact that I get to be with Mayor Omar and all the rest of you, that says something about hope in the future. And so I think that what I saw in that cloud was all the frustrations that now we need to turn them into all the things that we want this world to be. And I think Dr. Quinn, who's a very respected colleague, you know, said it very well. It's about getting through the next weeks and months of this situation with honesty, dignity, and caring. And you know, let's not let these 500,000 individuals who have died in a sense without something coming back. And I would just leave it with one last piece. This came home to me this week as I was trying to, as an epidemiologist, put into some kind of terms what 500,000 means. These are not 500,000 a number. These are 500,000 grandpa and grandmas, moms and dads, brothers and sisters, cousins, colleagues. And I thought to myself, if you really want to understand how dramatic this is, if I were to, in most respectful way, recite everyone's name who has died in this past year from COVID in this country, and I take 3 seconds to say John Doe, if I could do every 3 seconds, that's basically, as you know, 20 a minute. And you know what? It would take me 17 and a half days, minute after minute after minute, reciting those names to recite everyone's name. That should give us some sense of what we've been up against and where we're going. It's going to get better. And that's what we have to understand about this pandemic. It's taken us to a bad place, but now it's our job to take us to the good place. And so thank you again for having me here to even be part of this, because this is where the good place starts.
Thank you so much. And I really like the metaphors and the stories you tell to help put it in context, because I think at some levels, people are almost numb to the magnitude of these numbers. So we're going to make a bit of a transition. We're going to bring to the stage panel 2. So the first panel can just turn your cameras off. Dr. Osterholm, you keep yours on all the time. Gloria and Omar, keep yours on. And in that transition, I'm going to show you what it looks like when we translate the message, Dr. Osterholm, into a culturally tailored approach. And I want Omar, let me know, do you see a full screen, Omar?
Yes, I do.
Okay. All right. You can adjust the sound on your end, ladies and gentlemen. Here's what reaching people where they are looks like.
Got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. I'm the king of rock. There is none higher. DMC, I will inspire. Time for us to trust and not debate. The vaccine, believe it's safe to take. 9 out of 10 people won't get sick. That's 90% effective and legit. This COVID thing is real and it will find you. It's killing our people. Let me remind you. Back in the days, there was polio, smallpox. Back in the days, measles and mumps, man. Back in the days, but because of the vaccines, none of those stayed. Vaccines, they work to trigger immunity. 2 shots, we got antibody security. We gotta act now. No need to wait. Get your vaccine before it's too late. For real.
All right. Now let's
like that, Doc.
Yeah, and we hope that scientifically, it's still sound.
Yeah.
And yet culturally tailored.
Right.
That's the way that people will listen to these messages and get it to the way that they will hear them. Yeah. So I commend you for putting all that together and getting that access to the people. And the community, our Latino community, that's what we needed to bring, having in their own language and videos like this really bring that message home.
And I can't help but to think about what Dr. Cook said in the spirit by which she talked about her reservation initially, and how she had to not only research but pray to get to a space where she took the vaccine. Even as a surgeon, she was feeling some kind of way, as they say, and for her to move to that space with knowledge, I think was critically important. And I think that's what we need to do, is we need to make sure that we are not just shaming people for not getting the vaccine, but informing them so that they'll have the kind of knowledge and security in their thoughts that they can readily take the vaccine.
I think that you should know that your tax dollars pay for that. So for audience, but yet we need to make sure that people see it and they have access to it. So in our second panel, we have Reverend Dr. Harry Close. And you can, as you do a thumbnail introduction of yourself before we open it up for discussion and Q&A, tell us a little bit about yourself and what you saw in that video and or in the word cloud. Dr. Close?
I'm Dr. Harry Close. I'm the national president, mentioned earlier, of the National Funeral Directors and Morticians Association, comprised basically of African-American funeral home and Hispanic funeral directors across the United States and in 22 other countries. When I looked at that wording, I could experience all of them, but I just come to one major word: exhausted. With all due respect to the panels who are in the medical field from the front line, we sometimes forget about the end line or the last stage, the last offenders. And we're dealing with the result of COVID. And in our discussion, I hope we talk about, no disrespect to my colleagues, many times COVID is not on the death certificate until we pick the person up. And I could share some things that just happened with the medical examiners. The World Health Organization and the CDC, we have such a different dynamic. And my colleagues are exposed and dying at a level that is not really known across the country and their staff. So I hope when we come from this aspect that we look at the last defenders of the community, and it's always our funeral director, or your funeral director is the last defender to the community they serve. Thank you for that.
Thank you. And in that discussion, I'd like you to share about what you are learning about what's happening to funeral directors and whether or not they're designated as essential workers, if you know what I mean.
Before we move on, I want to make sure that Dr. Close did not say it, but he's a former board member of Tuskegee University. So we want to make sure that we put that out there as well.
I received that. Plus, I know some of the offspring of the Tuskegee syphilis tragedy. So I got a really different perspective when we're having that discussion as well.
Absolutely.
Ms. Leslie Sherrard?
Yes, good evening. I'm excited and honored to be here to talk about this very important subject. I'm a licensed clinical social worker and the owner of Strength for the Journey. My primary role, I serve as behavioral health specialist for MedChi CTO, supporting the largely Medicare patients of a number of primary care practices across the state of Maryland, but also work with a number of other adults. Here, kind of on the front lines of behavioral health, I definitely see the impact that this pandemic is having. Anxiety, depression, isolation, grief. And I think it's important for us to not only validate people's fears and feelings so that they know that they're heard, but I will tell you, discussions of the vaccine do come up in sessions. So I make it a point to listen to patients, to be able to hear what they're experiencing, and just be able to provide some support as needed in their own worlds. And I will just share, it can be really heartbreaking, but it also can be very hopeful as you are working with people and helping with coping skills and letting them, number one, know that they're heard and that they matter.
Thank you so very, very much. Mayor McKinley Price.
Yes, sir. Hi. I'm mayor of Newport News, Virginia. I'm also currently president of the African American Mayors Association. We represent about 500 minority mayors across the country. And just wanted to comment on that video. I was happy to see something creative and unique that's going to be needed in order for us to help educate those who are reluctant to get the shot. I'm also a full-time dentist. So I was happy when I got my shots because it's important that we understand that there are those of us who are at risk every day with this. And we try and do, like I was filmed when I got my shot, to try and make sure that we do a public service announcement to try and get more people aware that this is needed and it's not going to get any better until, we get a herd immunity. And we're hopeful that messages like that will come across and people will, once the vaccines are available to everyone, be able to get their shots.
And Mayor, you see how in the video they did a little translation of that herd immunity,
yes.
Right?
Yes.
And when we get to the discussion, we'll ask the scientists, is that accurate? Community immunity.
Right.
And so very, very glad to see that. Well, let's go ahead and see the results of our first poll. Go ahead, Chinadu, and show that on the screen. One of the things that we, okay, so here was the question. If your turn to take the vaccine was available right now, how likely would it be you would take the vaccine? And as you can see here, I know we have Dr. Half out in that audience, 83% very likely, 15% somewhat likely. So we don't have the demographics, but this is a group that is open to the vaccine. But look at that 15%. We have almost 200 people here. And that's a group that we want to understand in that Q&A. What are the dynamics going on that have them somewhat likely? And how might we build educational programs and communication around what it is they're facing? But we heard from Dr. Tuesday Cook, it's not easy, even as a scientist, even as a physician. People have to have their own journey.
What's another thing too, Dr. T, is this, and I want to bring Dr. Osterholm onto this conversation, because how we address the issue of distribution will also give people more impetus to take the vaccine if they see that you are fair and equitable in how you're dealing with them from even the distribution perspective. But if they see that there's disparity in distribution, then they believe that the system is still rigged against them. And so therefore distrust it becomes more pronounced in their lives. Dr. Osterholm, I want you to talk from that perspective.
Well, you absolutely hit it right on the head. We have to have every aspect of the vaccine development, manufacturing, distribution, and even what I call that last inch, that needle into the arm, has to be seen as being about and for them, not about and for somebody else, and you're an accident that got caught in the way. I think one of the challenges that I continue to see is that we also have to work hard to make sure that we make the vaccine available in the way that people can access it. So if public transportation is a problem and you have to go multiple miles to get a dose, if you're in a community where the challenges of having a community health center is nearby, whatever, you don't have that pharmacy in your community that is delivering the vaccine, but it's in the neighboring community, 20 minutes away. We have to look at all of those. So everyone should have the same equal access to the vaccine, regardless of who they are, where they live, or what they do for a living. And that's a really very important point to celebrate why everyone basically is treated the same in getting a vaccine.
Let me ask this question just to follow up, Dr. Osterholm. Because people of color are disproportionately impacted, why do everything have to be equal now? We're not dying equally.
What I mean by equal is, and you're absolutely right about that. Let me just be clear. What I mean by equal is that somehow someone is not taking your dose, or someone is there with your dose. We have a number of issues that come up around risk, and surely race, ethnicity, socioeconomic status, age, occupation, they all come together. For example, essential workers are surely at a higher risk for the infection than some other occupations. Well, if you look at race often overlaps a great deal with that. And so I think you're absolutely right about that, Mayor, that we want to be careful that when we say equal, I'm not talking about equal in the sense of one dose here, one dose there per that, but equal in the sense that we're trying to stop the transmission of the virus. And what we have to find is the vaccine going in an equal way to the risk of the virus for what it should be, and not being dropped out or missed.
Okay.
So let's have our all the panelists. You can turn on your cameras. We'll have all the panelists, panel 1, panel 2. You can turn on your cameras, and Chinadu, go ahead and put the second poll in the chat. And while we're talking, people can go ahead and vote. And let's open this up, Omar and Gloria.
Yeah. Can I go back to Dr. Cook a second, because I just she just really set the stage for me, and I want to know, how does she feel we can get people past the feeling of distrust? How do you build trust when distrust has so permeated your mind and your spirit for so long?
So, I think, thanks for asking me, Mayor. I think that is a $1 million question, because it's been about 402 years of distrust, and it's not just with healthcare, but it definitely spills over into areas of work environment, the daily stressors of living with structural and institutionalized racism, the fact that, you have to hustle from job to job. You may not have a steady place to live. And that is also, again, associated with racism. The fact that we have a lack of appropriate build environments. The fact that we have, issues with childcare, just the daily grind that we have to be on. This is one small aspect of it. And so I think trust is earned. I had a friend tell me that yesterday. Trust is earned. It's not given, it's earned. And so transparency is going to be one of the things that can help with administration of or receiving the vaccine. And I want to make sure that we're all very clear. There is mistrust, and that mistrust runs deep, and it's real, and it should be it should definitely be validated. It's valid. You know, so many things have been learned based on breaking the backs of Black bodies. And so I want to make sure that we know that, yes, we want to gain trust. We have to earn that trust. But in some instances, the trust is there. There's lots of trust in people who want to get the vaccine, who can't. And that speaks to Dr. Osterholm's point in that access. This just really, it really brings to light the access problem that we have and we have had for hundreds of years, you know, not just for rural people, because, you know, people in rural settings or Black people in rural settings have difficulty getting the vaccine, but so do people in the urban settings. Wait online for hours, who have to miss a day of work and thus don't get paid, and so may not be able to pay their childcare or their copay to see their doctor or buy groceries, you know, from a place that sells fresh fruit or not a bodega. I mean, there's so many aspects to it. I think that trust can be built with transparency, speaking to people on the level that they can understand. You know, I can't come in there and say, oh, just mRNA builds a spike protein, and so you'll be fine. I have to make sure they understand, well, you know, this is the way that it gets in. It's not live protein. Your body's enzymes break it down in a couple of days. This is, you're not gonna get sick from it. You know, this is to make sure your body is primed to fight the actual disease. I have to make sure that I get to the level that the patient understands, the person understands, so they can say, oh, okay, they are now educated at their level, and so can make an informed, a true informed decision. That's one. So transparency, education of the patient on their level, and making it available to people so they can get it. If you need a 24-hour pharmacy to give it to people who work during the day or who work the night shift and need to get it at midnight or need to get it during the day, then you need to do that. Yes, you know, not people have access via bus, but we don't want them taking a bus. But you know, we do have those essential type jobs. Baggers and Uber drivers, they are us. They are us. We're not just physicians. We're not just, you know, lawyers and bankers, doctors. Here we are in Bowie, but you know, we are also the people who help things to run. The Latinx community, they make things run. And so we have to make sure that it's accessible, that we are transparent, and that we are educating the patients on the level that they can understand, so that they are open to saying, okay, yes, I want to get it. And then when they say they're open to getting it, we have to make sure that they can get it.
There you go. Because I know Mike's out there, and he said people who 3 weeks ago said, hell no, now they're saying maybe. And who 3 weeks ago said maybe, now they're saying, where do I sign up? And the people who signed up are saying, nobody's calling me back with an appointment.
Right.
And that's what we got to work with.
You know, that's part of the problem. Who's somebody can speak now. Who's saying something?
Let me do this. We got Dr. William Ashley.
Okay.
You want to just quickly introduce yourself?
Sure, thanks very much. I'm Bill Ashley. I'm a neurosurgeon and very active in, you know, issues of diversity and inclusion from, you know, aspects of medical education as well as access, and, you know, work with several groups to forward this mission. And I think that, you know, this panel tonight is just a fantastic example of how bringing together all these minds can help. I think we've brought up some of the issues regarding this issue of distrust and the issue of hesitancy. But I think one thing that I've always thought is important is that we think about the groups kind of accurately or correctly, in that not everyone who doesn't want the vaccine is poorly educated or disenfranchised in some way, shape, or form. As Dr. Cook brought up and others have echoed, the idea that there's a problem really is entrenched in the community in ways that, you know, span generations. You know, many of our parents are professionals, and that generation is very, very hesitant. They lived all these issues with Tuskegee and others. You know, the generation of the Lax family and their relationship to healthcare. That these things don't just stem from groups that don't know. We really have to kind of get through that and, you know, build this sense that there's been a change made in the role of equality and the commitment to equal and fair care is out there. And, role modeling is very important for that. Having us be out in the community and show that people of all different types really helps. The barbershop initiative and meeting people where they are, I think, is just absolutely critical, because we have found out, and we've known it for years. I haven't gotten a haircut in a little while, as you can maybe tell, but we have known it for years that we will talk about the important things in the barbershop way more easily than we'll talk about it anywhere else. And so it seems like a simple, small step to get them involved. And I'm happy, Dr. Thomas has mentioned many avenues that barbershops and others have been getting into it. Many of the hospitals in the areas are now bringing them into the fold by partnering with barbershops. And so I think that that's just the first step. We have beauty shops. We've got other social avenues that may be ways to deliver this vaccine in a seamless and comfortable way. I think we really have to start thinking about these other alternatives.
So, Dr. T.
Go ahead,
Gloria.
Yes, one thing that I get to hear a lot is about, okay, now I take the vaccine, and we're hearing a lot about it. A lot of people are doing it, but then we still have to wear the mask. We still have to keep the distances. So why then? Why should I do it? So that's one. And the other one is, now, you didn't do any studies with pregnant women. So are these individuals that are thinking to have a family should be taking the vaccination, or these women that are pregnant should be also be protected? So there are these questions. Are they altering my DNA? Is this something that is going to be safe for me genetically? So those are the things that we need to kind of emphasize, that is nothing that is part of the process, and that we don't need to be thinking too much about it. We need to still protecting us. I wanted to hear from the experts. How do we address those questions and tell them that this is just misinformation and go from there?
Dr. Osterholm?
Well, first of all, you really raised some very important points that run across all the landscape with these vaccines. Let me just start out by saying we have done a very, very poor job as public health professionals helping people understand what this vaccine is all about. It started out being called a vaccine from Operation Warp Speed that had all the suggestions that somehow speed was going to be the operative word, and that safety and concerns would be sacrificed for that. Second of all, the military was brought in, which surely could be fine, but for many people, they saw that now as something even more complicating. And what was this all about? Then, with all due respect to, without regard to political statements here, there was a lot of concern that there would be a political thumb laid on the scale of whether or not this vaccine would be approved or not, which then further made people distrustful. And then one day we just packaged it up and took it out to the states and dumped it off. And we didn't think about what, as I said, the last mile and the last inch. How do we get the vaccine? The point we made earlier about distribution. And Dr. Cook, thank you. You said that very, very well about how critical the kind of distribution had to be to speak to the ability to get the vaccine to everyone. And then in addition, that last inch, we didn't answer a lot of hard questions. The pregnancy question has come up time and time and time again. The issue about, does this make me infertile? This vaccine hasn't come up. And we weren't prepared to answer what is misinformation, disinformation, and even to the extent that I had, and I know there's physicians on this screen that will attest to this. Why did a national group of experts tell a woman who might be pregnant, well, go talk to your physician about whether they should get vaccinated or not? What additional information would a local physician have that a national group of experts wouldn't have had? And they just basically deferred a difficult question. Today, I'm very confident that the vaccines are very safe for pregnant women. We've looked at the animal data. We've looked at the experience to date. We understand when vaccines or infectious agents may be a problem, but we haven't articulated that nearly enough. And one of the things that I have very much stressed in recent weeks, find the hardest questions every week and answer them, and make sure we make this a national priority. And even if disinformation is out there, we will speak back to that. And we have to put it in the hands of people like Big Mike or Dynamite and
There you
people
go.
like that. So I'll get it right. I get it.
You
Sorry.
Big Mike.
I know. Thank you, sir. So, but I think that that's the kind of thing we haven't done nearly enough of right now. We haven't answered those hard questions.
Yeah.
And so you're exactly right, Gloria. Absolutely right on the mark.
Let me say this, Dr. Ashley, you made a point, and I want to throw your point to Dr. Close. You mentioned the fact that there are a lot of people who are not ill-informed, who are hesitant about the taking the vaccine, and they use incidents like the Tuskegee syphilis study. Oh, let me take that back. The United States Public Health Service experiment done in Tuskegee, because it was not the Tuskegee study, okay? But the point of the matter, that's kind of out of context. It was when they withdrew services or withheld services for those men because penicillin had become readily available and they knew that it would cure syphilis. And so they denied them the vaccine, if you will. Here, we're trying to provide the vaccine. So it's kind of out of context when you use Tuskegee, other than the fact of trust and distrust. Agree with that? And then I want you and Dr. Close to talk about that a second. Dr. Ashley.
Yeah, I agree with you completely. But I think the trust issue is the linchpin there, because at the end of the day, people feel like something ain't right. And you can't get over that without time, effort, and rebuilding. And I think that this issue of distribution is very important because everyone is watching. And I think the idea of fair and transparently, visibly fair distribution is helpful. The idea that nothing is happening differently in my community than it is in a different community elsewhere. And that idea will help people develop the confidence. And that's going to take time. It's going to take numbers. It's going to take, community pioneers who are the first to get the vaccine in their small cohorts. And it's going to take really active community efforts to begin to build that. And then I think we'll gradually start to see a wave of acceptance, early and kind of middle, and then, unfortunately some late adopters. But, every little bit helps. And, there are some, again, particularly older generations that really can't be convinced because they saw and experienced injustices that cannot be easily taken back. And so again, for them, it's going to take loved ones and very close family. And so the idea that we're spreading the message to a broad community, churches, schools, communities, we have to get to everyone who may be able to have some sway with the folks that are in that small percent, that 15% we saw in our survey, or even the ones who are not going to get it.
Mayor, I want you and Dr. Close to talk about gatekeepers in the Black community, right? Because we have people in the Black community that's not the mayor, not a city council, but they got more influence in that community than the mayor or the city council. Talk about how do we reach those people. And I want both of you to have that conversation.
Well, one of the things that I think that was helpful for me was a couple of weeks ago, we had, when I say we, the African American Mayors Association had the Vice President of the United States be the first intergovernmental agency that she had a Zoom with. And on that panel with her was Dr. Marcella Nunez-Smith, chair of the Biden-Harris COVID-19 Health Equity Task Force, and also Jeff Zients, White House COVID-19 coordinator. And then we have a panel that Dr. Osterholm also serves on, of 13 experts. you know, now we as mayors can tell those people who we can't reach, here is somebody who is nationally in charge to make sure that equity is going to happen. So I can talk to that minister, or I can talk to that barber, or I can talk to the person who's going to reach the people that I can't reach with my PSA getting that vaccine. Then listen, here, from the top down, we're trying to not only locally, but nationally have an effort to make sure that equity is going to be a part of this vaccination process. So I'm hopeful that as we continue to show that people, that we are going to be monitoring, and I've heard the word transparency a number of times, it has to be transparent, this process, but we've got to be able to get the vaccines and show that this neighborhood, and this neighborhood are all getting vaccinated at the same time.
Well,
Dr. Close, go ahead.
Yeah, I want to come behind the mayor and just give it even another. It's been proving in the African American community, your funeral director touches the entire community in a year and a quarter. So that means they're touching the entire community. It is a tragedy that the governors in this country, only 8 states are giving vaccines to the funeral directors, although the CDC said they should be 1A. As all the physicians know, very few death certificates will have COVID. Very few situations where I'm looking at the protection of the community. That funeral director, we've lost over 350 funeral directors in our association from COVID, not talking about their staffs. So this country knew that the funeral directors were being affected at the level that we're being affected, who's the defense of the community of serving these families. And then we have an issue. Are we following the World Health Organization, whose directive was, and I hate this to those who are listening audience, I'm going to be just as plain, direct cremation or burial, or following the CDC, even though we know that those physicians know following the science, even though the last 4 years science wasn't the focus, which says universal precaution, and yes, this person's viewable. No one's giving off the symptoms, but my members and my colleagues are exposed at a level, which means they're exposing the community. Let me talk as a pastor. I'm losing colleagues as well as in the African American community. We're losing funeral directors and preachers. That's major. And what are those 2 categories of profession? We serve people and we have a touch of the people. And I said, so my issue is this: why are they're not getting the vaccine? Now, I will be honest. I have a young staff. Very few don't want to take the daggone vaccine. I am a educator of teaching world embalming. I'm the only one in my operation embalming. I'm actually embalming for 15 different funerals, if that family wants to see, because no one wants to be exposed to the virus. And there's some other issues that's more prevalent than just COVID. But I want to say this to the Maryland physician. We got a new medical exam. Last week, I had 4 autopsies. All 4 of them were COVID. It wasn't mentioned on the death certificate when I went to see my procedure now. So let's see what this person died from. My staff gets to the daggone medical examiner and they have COVID written all over the body, and it had an autopsy. It's an airborne virus. And so now we have disinfected the body and it's open. These are issues that as funeral directors, I used to be the president of the state board in Maryland. I used to always argue with the physician board. Can you first write it clearly that we can read? And can you actually put what the cause of death is? Because that funeral director is touching the family and the community, and they need to know what the health is. Now, some of us might not want to have that big discussion. I'll have the discussion with you after we leave here.
No. This is Dr. Close. You know the kind of conversation we have, right?
Yeah,
right? This is that kind of conversation.
I don't want to lose some of our audience because I really want to go into some technical things, but I'm trying to be polite as we go because I'm also a health provider as well. And sometimes we forget that as when people look at funeral directors, they forget that funeral directors are healthcare. And I have attended enough funerals of my colleagues that is scary, and we don't hear about this. I hope we can, with my colleagues on the front end, and I thank God for you at the front end, please advocate for the end, the last stage, because the funeral directors is just a part of the health system as the front end. And I know, and you know, that people are not coming into these facilities unless it's the last minute. And the way this virus has mutated, we're being all exposed. So if we can get these if you can get your mayors to talk to the governors of your state, my members want to be receive the vaccine because we already know we're exposed. And these governors, I just cannot, and I'm just throwing them out there because I had to write a letter to my governor. Why are we not being vaccinated? Now, I just got my second vaccination, so I didn't really mind being exposed to the 4 COVID cases, but I still get tested every Friday on a free vaccine test. I mean, I want to make sure I'm not taking COVID home to my family. Absolutely. I want to make sure that I'm not trapping. And here's the issue, that we're trapping it, we're walking into it. We're not just someone spewing it out. It falls, those drops fall, and people are walking in it, and they're walking into facilities. So there's something we need to also educate to all those educators. Let's educate them before you go into your home. Take those shoes off, take your clothes off, disinfect, that you're not carrying it into another facility. Right. Unfortunately, you know, I don't want to monopolize. We
you know what? That's why we're going to have more than one of these sessions. We have continuous sessions, but I don't ever want you to feel in any way that you cannot share your truth, because we are all possessors of some truth. And as we bring our truths together, then and only then do we get closer to the truth.
I receive,
Dr. T.
I
know.
Now listen, what an amazing discussion. And I want Dr. Osterholm to know we did not have one epidemiological slide yet, okay? And for all the physicians out there getting their continuing medical education, this is also what you need. We have a social worker here who's dealing with the families after they've lost a loved one, and who's dealing with the healthcare workers and the folk on the front line afraid of bringing things home to their family. Ms. Sherrod, what are you seeing and what are you hearing here?
You know, the impact is real. I've worked with educators, healthcare workers, seniors, and you know, you could have a session with someone one week, and then the next week, multiple people in their family have the illness, or coworkers have passed away. So you see the grief. And I think something that's not really brought up is the idea of trauma. Even before COVID hit our communities, there was so much trauma related to everything from social determinants of health, systemic racism, all these issues. And then in the middle of that, you throw in a pandemic that is disproportionately impacting our communities in illness and death rates. But I do want to just say two things, two words that I've been hearing a lot tonight: community and hope. We use the word community sometimes, and we think of it as something out there. We are the community. And, you know, the question about how do we build trust, you know, it's one by one. You know, I mentioned earlier about people wanting to be heard. It's one by one. It's, you know, community is happening at the dinner tables, at the barbershops, in virtual church services. You know, I kind of went through a similar process that Dr. Cook mentioned earlier. You know, I had some hesitation about the vaccine. I did end up getting it. And I felt like it was important for me to post that on Facebook. And a day or two later, a family member called me and said, I saw your post. I had been on the line about this. I'm going to get it too. That's community. So I just, you know, just really want to emphasize the idea of community and hope in the midst of everything. I tell my clients, you know, unfortunately, I don't have a magic wand. We can't change necessarily the circumstance, but we can change how we're dealing with it in the middle of things. We can change how we are approaching things. And I say that both on an individual level and at a systemic level, we can change how we are approaching things. And we do need hope to be at the forefront with that.
Thank you. Dr. Branch, you heard about the distribution issues. We finally get people to move towards maybe acceptance, and then they can't get an appointment. And then they see an inequitable distribution of the vaccine. That falls sometimes on your plate, doesn't it?
It does, but let me kind of just step back for a moment, because I think that we're talking about distrust and we're talking about the COVID vaccine, but I got to erase the COVID vaccine for a moment. Quite frankly, we all know that we have been dealing with health disparities for decades and decades and centuries. So we know there's an issue when it comes to high blood pressure, when it comes to diabetes, when it comes to obesity. We know there's an issue when it comes to food instability. We know there's an issue when it comes to transportation, work, education, racism, the whole works. It's there. The only thing COVID-19 did was shed a light on what was already there. And what my concern is the fact that we focus a lot on trying to get people that vaccine. But the reality of the situation is the fact that all those other issues we don't deal with. We know that they're there, but we're not dealing with those. And until we deal with those things, I think that we're not going to have the trust in the community. Now, when it comes to when I speak to my patients, the constituents about the vaccine, I say to them, please, I need you to have some trust in the medical field. And they say, I don't trust. And I said, listen, as a person in the medical field, I'm telling you, I believe it's best for you to get the vaccine. They don't want to get the vaccine. And then what happens? They get the disease. And when they get the disease, who the first person they come running to? You come right back to me. And now I have to experiment on you because, in fact, I don't have a treatment for that virus. So what I'm going to say is the fact that what we're trying to do and what I'm doing locally is I'm trying to get the vaccine into the arms of people by going to where they are. So I've started some transportation things where I can actually transport people to the vaccine. And also I'm collaborating with different churches and community locations so that the vaccine is actually within the community, within walking distance. And I'm also working with the fire department, and we will be doing the vaccines to the homebound patients. We're trying our best. We're trying to get it out there. We're racing against the clock because you know that when I do that kind of stuff, it takes me time to do that. And when I take a long time to use the vaccine, they don't give me more vaccine. So I, in Baltimore County, am able in my mass vaccine clinics, I can give up to 1,000 vaccines per hour. That's probably better than anybody in Maryland and probably better than most in the country. I can do that in my vaccine clinics, but I still don't feel that I'm successful because that's not getting into the arms of my Black and brown constituents. And for me to get them into the arms of my Black and brown constituents, I've got to take more time to actually go to them and give them that vaccine. So I hope and I pray, and I hope you guys can pray with me as we talk about trying to get more vaccine. Because as soon as we can get more vaccine, we can get it into the arms of our Black and brown constituents.
Dr. Richardson, trust is a calculated risk. How do we enhance the trust in not the medical industry, because I think that's going to take much more time, but in you, how do you get people to trust you, and particularly people of color who are in the healthcare industry?
Well, as everybody has been saying, it's going to take listening to patients. It's going to take overcoming these barriers. It's going to take validating the patients. And to do that, you need to have culturally competent healthcare, meaning that you understand the patients, you understand what makes them tick. The CDC talked about the social vulnerability index, using the burden of disease and distribution to be more equitable in distributing the vaccine. That's part of it. You have to understand where the problem is. As Dr. Brand said, you have to go to the people and they have to trust you. And the only way they trust you, as Dr. Cook said, is trust is earned. So you have to be on the ground. You have to have a rapport with the patients in a real world setting. That's how you remove some of those barriers, and you implement best practices on how to build trust. There are ideas and guides out there on how you can do that, and we need to stick to that. I know that there's in Baltimore, I heard on the news the other day, the Healing Health Alliance, and that's they help deal with the trauma, and that's both psychological trauma and physical trauma that our community has dealt with, that we have to first let folks know that we understand what they've gone through. And we do that by listening to them. Unless they trust you, they're not going to listen to you. So again, going back to the culturally competent care, whether it's coming from the physician, whether it's coming from the social worker, whether it's coming from the dentist, whether it's coming from funeral.
Yeah, we got it.
These are folks who are culturally competent. Empower the barbers, empower the beauty consultants. That's how you build the trust. And it's not one person. It's our community, again, using that.
So Omar,
Mayor O'Neill.
we got it. It's a little bit slow on the internet, but we got you, Dr. Richardson. That was right on target. And Dr. Osterholm has all kind of notes to take back to the room where it happens.
Right.
He's on the front line hearing what we're going through. And
Dr. Osterholm, understand this. We're not talking about thinking out of the box. What we're talking about throwing the box away.
Now I want you to go to that chat box, got a poll in there. And while we're talking, go ahead and vote the second.
But I think also we need to, because we also have to listen to the immigrant community, and they only speak with one language. Yeah. So we have to be getting into that and how critical and important that is, because you are dealing with, we send a lot of written materials and many of them may not even be illiterate in their own language. We shouldn't assume that. So I think that those ideas of going where the community is and getting to get the message across with individuals that understand the community and they are from the community is going to be critical on this and beyond, because Dr. Alston, this is not the last pandemic that we're going to see. With these changes, the climate change, we're going to see more of this. So we have to be prepared for the next one. And it's not going to be 100 years, which is kind of sad to think about that. But I think it's important, critical. All of these shouldn't be just for this particular instant of time. We have to be putting this as part of how we do business, how do we relate, and how we are part of a community.
The down south, we say you have to put it where the cows can get it, meaning.
Well, the way that we're eating right now, we're all cows.
Hey, now listen, we have an audience out there of 100+ people, and they got questions coming in. And so while you're voting, be sure you go in the chat box, follow the link, and vote. And we'll show the results a little bit later. But now we have some questions coming up from the audience. And Meg, you just let me know when we have a question that we can read from the audience while we continue this conversation. I just want to say to Dr. Ashley and Dr. Osterholm, for men of your stature to give credence and credibility to dynamite there in the barbershop means a world of difference. They have now become certified community health workers from the state of Maryland. They are now part of the team of health workers. And so going forward, we need to make sure that we include them as we move to address these health disparities. And we got people in this audience, members of MedChi, who can help make that happen. And so Dr. Quinn, I'm curious as to what you think about the role of communication and how that might be different than let's message somebody.
Well, if there's one thing that makes me want to pull my hair out, is the discussion of messaging. Because messaging means I'm talking to you listening to you. So communication's vital, and big and dynamite and pastors and providers are all critical. And it's not everything, because I think it has to be matched by action. So empathy is vital, being able to listen to people's questions, being able to acknowledge, yes, from the history of Tuskegee and Henrietta Lacks to current bias in the healthcare system to, police shootings. There are reasons people don't trust us. And that's not just solved by communication, but listening's part of it. But I think the other part of what we need to do here is say, do we even begin to meet communities part way? Do we, how many, are complaining that if you're the Instacart worker who's buying, shopping for my groceries, you can't spend 3 hours every day on a computer trying to get a vaccine, right? You can't do that. Or if you're an 85-year-old lady, who still has a flip phone, you can't do that. So we have to do the communication, which is always two-way. And we have to change some of the systems to make it, to make it equitable, and to give everyone that chance that when they are ready and they're listening to all of the physicians, when they're listening to their pastor, when they're listening to Mike Brown, that then they actually have a shot at getting this vaccine. And that's the part that we're just not doing it. We don't have, we're talking a lot about hesitancy and a lot about messaging. We're not listening real well, and we're not setting up the systems to facilitate the people we're concerned about talking about getting this vaccine.
Dr. Osterholm?
Yes, and I just want to follow up on Dr. Quinn's really thoughtful comments. The other thing we're not doing is taking time. We're in an urgent need to get people vaccinated, but some people take different times. And Dr. Branch, you said something very, very important. Right now, we're in a race where every day we want to see the numbers go up and up and up for the vaccines. And that seems to be one of the driving forces, which is not unimportant. But it's going to take more time in some communities to do this, and you can't be penalized for having to take more time. In fact, you should be rewarded with additional resources and even additional vaccine, as opposed to having it taken away from you. So I think all the things we've heard tonight here is we have this absolute kind of, you might say, juggernaut of trying to move things forward as quickly as possible because that virus is out there, but at the same time, making sure we take the time to do it right. If we end up hurrying and talking down to people or talking to people, as Dr. Quinn just said, we make a big mistake. You get one chance to give a first impression on this issue, and we've got to do it the right way.
Well, the last time you were on this show, Dr. Osterholm, you left an impression with all the barbers, and they have given you a nickname as Big Mike, and you need to know that's a compliment.
Yeah. Well, you got street cred. That's what you call having street cred, Dr. Osterholm.
Thank you. Well, can I just say one thing? This is also where I think we all have to have a sense of humility, because when we're dealing with this virus, there's a lot that we don't know, and there's a lot that we surely can come together. I learned more from working with you, Dr. Stephen, and the entire group, the barbers. I learned more from them than I think I could ever have taught them in a given night. And I think that's another part of the message here. If we're going to be successful, we got to learn from each other. And sometimes it's the person living in the neighborhood who knows more about how to do what to do than any of us who have degrees or titles or whatever. And I think that comes back to this idea of taking time to listen, to understand, and to do what we can do the right way.
Well, Omar, let's listen to some of the questions from the audience. Meg, have you queued up a question? Read it out loud for us, Meg.
So we have a question. Approximately half of our hospital staff has declined the vaccine. What is the best way to approach this issue?
Okay. We're talking, these are Maryland healthcare professionals. Who wants to take that?
I could. That's a big issue. And we kind of touched on it before when thinking about folks who are in the know, but still kind of don't want to do it. And, certainly people in the hospital have access. So this is where the trust issue is. And when we think about who those people are in the hospital, because, there are different folks in the hospital from different backgrounds with different life circumstances. And so I think we have to really focus still on those issues that affect the people who are more likely to be affected and more likely to have concerns about trust. And I think, Dr. Branch, you really kind of started to touch on this iceberg, which is we as a community are facing some of the same issues now with the pandemic that we have faced with the war on drugs in the past. And that is that it seems that the concern, and to many people involved, it seems that the concern has been a brand new thing for a problem that a community has been facing for many, many, many years. And so we've got all this concern about the pandemic when the communities are facing an epidemic of healthcare that faces them every day. And so many folks feel slighted and wonder, why is there so much concern now when just a year ago we were facing death at alarmingly high rates from diabetes and heart disease and lack of adequate medical care, gun violence, police brutality. And these are the folks that, when offered a chance to get the vaccine, have hesitance and even feel like maybe they're not really wanting me to take the vaccine for myself, right? And I think, Dr. Osterholm, you really touched on that earlier, the idea that this process is for them and their communities and their families. And that we have to hammer home.
Meg, let's get another question in. Get another question in from the audience.
Dr. T, can this be mandated?
The vaccine?
The vaccine?
I wonder in some health settings whether or not they're, I don't know.
I don't know if legally you can do that.
It hasn't happened yet. But the question is, what would that mean when you go that approach?
Yeah. So there are some states. So New York actually has a clause written in some of its national state law that says that in the instance of a pandemic, that they may be able to mandate a vaccination. And they tried to push it through with some other legal proceedings. Maybe I think it was at the end of last year. And I don't think it really went anywhere, and everybody got very upset and nervous. And even friends of mine who again are professionals were like, well, I'm moving out of New York and I'm not getting that. They try to force me to get it. But there's some language written in some instances, and I don't think it's actually law, but in the instance of the pandemic, that they could decide to do certain things. I think that language also made people very nervous about proceeding with something that is, people don't like to be forced to do things. You know, you have a diabetic that's on Lantus and that's on, an Novolog, they don't want to change. They like this. Well, your blood sugar will be a little bit better if you do such and such. They don't want to change. So until you, again, educate them about what's good, nobody wants to be forced to do anything. So hopefully that never really comes into play.
Yeah, let us hope we can get there before that. But Meg, you got another question?
Yes. Could the panel address the inequity of health coverage? Do we think that the higher death rates in communities of color is in part related to the lack of access to care? Is this the opportune time to consider healthcare for all or Medicare for all to reduce the impact of COVID and other illnesses on people of disadvantaged groups?
Okay, well, that's a big question, and let me do
right.
Let me throw the ball. Dr. Osterholm, you like to do balls and strikes. I'm gonna throw the ball to the outfield and see if Ed Ellinger out there can catch it. Ed Ellinger and I worked with the Big Ten bringing a health equity initiative. Ed, how would you address that question?
Well, certainly thank you, Dr. Thomas, and really, I have been really appreciating this conversation. This is a powerful, powerful conversation from voices that we need to hear. But certainly specific to this question, it has been shown that universal access to healthcare is one of those social determinants of health that has been disproportionately available to people throughout the community. And I think I need to emphasize what Dr. Branch said, that it is the whole system that is against the people of color and indigenous populations. And so it's not just about Tuskegee and what happened in the history, it's what happened last week or what happened yesterday. All of this discrimination, all of this inequities are happening right now. And access to healthcare is one of those things, in addition to access to affordable housing and access to IT and access to all of those things. Yes, we do need to focus on the specifics of the pandemic, and we need to get medical care and public health and our public policy folks to start saying, what do we need to do to our system to make our whole socioeconomic system much more equitable? It's a big challenge, but we're never going to deal with all of the existential threats we have. We're not going to deal with climate change. We're not going to deal with pandemics, and we're not going to deal with racial injustice until we really deal with those inequities.
Omar, can you believe, Omar and Gloria, can you believe how fast this evening has gone?
Always.
But it's always like this. I mean, you've heard the saying that the time flies when you're having fun.
That's what
definitely.
What we want to do right now is give those take-home messages. Now, what is the take-home message from tonight, Dr. Quinn? Take-home message.
Well, there are lots of them, but let me just start with one, because everyone else has things to say. And that is, let's look at the systems we have in place right now. Let's assume that not everyone is hesitant, that people may be reluctant for good reason, but then let's create systems that enable them to be listened to and to actually get access to this vaccine.
Ms. Sherrod, take-home message.
Take-home message, going back to the idea of community. If everyone in their respective roles, barber, doctor, clinician, academia, hair salon owner, if everyone does their part in the community, we can change the information that's out there and just provide that encouragement for what's needed.
Now, Dynamite was out. Dynamite was working and listening. What's your take-home message, Dynamite?
Dr. T, we just need to see the press on you.
So Mike, you got a bad connection, but
you get the message out to the people.
Mike, you got a bad connection, but go ahead and mute yourself, Mike. Go ahead and mute. But that is the example of when you put life-saving resources on the other end of the internet, you got to have good connectivity. Dr. Richardson, take-home message.
Take-home message is, for me, this is a very vulnerable population. This isn't, the pandemic is new, but we've been struggling with these diseases of the heart. We've been struggling with malignant neoplasms and cerebrovascular diseases and respiratory illnesses. And life expectancy for the African-American male has dropped by 3 years. It was already the lowest. It dropped from 69 to 66 when the average death age is 79 in the US. So that's just an example of where we are now. So the pandemic, yes, it's shining some light on these people who have no voice, and we have to be the voice for these people and continue to be vigilant and continue to fight to shine light on these disparities.
Dr. Branch, take home.
Well, I'm just going to go from a very practical perspective and go back to the 3 W's. Wash your hands, wear your mask, and watch your distance. God bless you.
There you go. It worked 100 years ago. It'll work today. Mayor McKinley.
Well, I want to just emphasize that with distribution, one size doesn't fit all. Some of you may be blessed with great public health departments. I am not. I'm in a city where there's 6 cities under one public health director. It's about 500,000 people, and the distribution is just not happening the way it should be. If we had the vaccine, our city could put shots in arms directly, and it's going to be a slow process for us.
Dr. Cook, take home.
My take home is pretty much the same as Sandra Cross Quinn, that everyone does trust and make that vaccine available. If you grant access to people, they will come. That's in general. I guess my second take home is once we start getting people vaccinated and we address the injustice that is vaccine inequity, that we address the inequities that affect Black and Brown and Latinx people in all the other aspects of their lives. Let's not stop here.
And Dr. Close, take home message.
One area is I like the word trust because in my profession, we deal with people at the most vulnerable time. So we're able to reach out. So I like the issue of trust and also getting some material that we can educate our families as they go through this process. So, I was going to also say, and thank you for receiving my passion this evening.
Indeed. I think we need to do a town hall for the funeral directors and the people who work in your field. Dr. Ashley?
Yeah, one message is that we should all be energized, hopeful, determined, based on having a talk like this tonight. So I think that we're moving in the right direction. And we just need to remember that these people, these groups that we're talking about, we are those people. So we need to think about fixing the problems just like we'd fix it for our own families. And if we do that, then I think we will build that trust, that transparency, and can deal with the pandemic and the greater, larger epidemic of kind of disparate care that we face here.
And Gloria Blackwell, what's the take-home message?
Listen, we're almost near to start getting those hugs back, to see our grandparents, grandma, grandpa, and having everybody together and having a very nice meal with everybody together. Let's do this. Let's get vaccinated. I know we have questions, but we can do it together with this information. And I know Dr. Osterholm is doing everything possible to make us safe and get it ready for this.
And I want the audience to know that in the recording, we'll show you the results of the other polls and things that we've done. But I really want to ask Dr. Osterholm, all that you've heard, you sit in a lot of big rooms, and in this one, we did not have one slide of a death curve or a COVID curve. And we are talking to scientists and physicians out there getting continuing medical education. What's your take-home message, Big Mike?
Well, thank you. And I too, Gloria, I want to thank everyone here for the opportunity to be here. I learn every time I'm around you. You're a mentor. We're not here today and we're not doing what we do today because it's our job. We're not here today and do what we do today because we're smart. We're not here today and do what we do today because we have financial resources. We're here because we care. And I think the most important message we could get across is we vaccinate with care. We vaccinate because of care. And I think that becomes a very important measure. How much do we care? Why do we care? Sometimes care takes time. Sometimes takes patience. It takes understanding. Sometimes it takes opportunity. But I think in the end of the day, I will leave here today realizing, seeing all these wonderful, wonderful voices, I was with the good people today who cared.
Thank you. Thank you very much. And we want to show you something before we roll out of here. So I want everyone to stay tuned. All the people in the audience, stay on. I know we're running a little bit over, but I'm going to give Omar, take us home, and then I'm going to set up our last educational short clip that'll take us out. Omar?
Well, one is, let me say to each and every one of you, this was an absolutely wonderful conversation. Let's keep the conversation going. Dr. Osterholm, we appreciate you. We appreciate your humility. We appreciate your care and your love for all people. And so thank you for joining with us today. There's a thing called trust, and trust is a calculated risk. And so I just admonish each of us that every day, let us just chop wood. There was a story that a person just chopped wood every day. And although they didn't know when the tree was going to fall, they chopped wood, recognizing that one day, if they did their part, the tree would fall, the tree of racism, the tree of inequity, the tree of discrimination, the tree of marginalization, the tree of subjugation will eventually fall if we all wake up each morning and just chop wood.
Just chop wood. Okay, I want you to see what a cultural message looks like and sounds like. And I want the reverends out there to pray right now. Anytime I start doing this, stuff happens. All right, hold on. Here we go.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. All right. Trust me, believe me, we're not gonna have another Tuskegee. This ain't eugenics. No way. Nobody getting away with hiding information today. Got the FDA, CDC, black doctors and experts for you and me. There's a whole lot of data for the world is free. Do me a favor, check it out and you'll see. I gotta give a shout out to all of those involved that's helping us get this problem solved. People wanna know, is the vaccine safe? It doesn't have anything to do with race. 9 out of 10 people won't get sick. That's 90% effective and legit. We gotta act now. Please don't wait. Get the vaccine before it's too late. For real.
Okay, give a clap, give a virtual clap. Thank the creators of these targeted, culturally tailored messages. We'll make sure you have that to share with your patients and the community. And Big Mike, hopefully you got a little better connection. Come on, unmic and take us home.
You telling Mike to unmic? Mike can't unmic.
Go ahead, buddy.
It was a pleasure to be here today. It's definitely awesome to listen to the information so we can be relaying it back to the community. We just want to keep that the same energy going and keep chopping wood.
There we go. Keep chopping wood. Thank you all very, very much. We'll send an evaluation of this event out by email. We're going to do this again. Ed Ellinger, thank you very much for being
and
out
poll,
in the audience.
the last poll.
Okay. Do we have it?
And the poll, the last poll.
Here we go.
Okay.
Do we have it?
And the poll, the last poll.
So this is a before and after.
We change up some views here.
You know, the one that was not at all likely, that one has completely disappeared.
Okay. Now, while this is not a randomized social science research, we changed some opinion tonight just by talking. Thank you all very, very much. Be ready for the next time. Bye-bye.
And as always, remember these 2 words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Bye-bye.
The power. Bye-bye. Thank you,
Bye-bye.
Medkai. Thank you, Medkai. And the Idea Task Force. Bye-bye.
See you guys.